her husband. She was a homemaker and was admitted to Wusthof in Rockledge on April 1st for a hemorrhagic stroke. She presented with right-sided weakness, difficulty speaking, difficulty swallowing, and just general fatigue. She was then treated and discharged to Consulate for rehab for her right-sided weakness. She was improving well, but then had some shortness of breath and was taken back to Wusthof, where they admitted her and found that she had a pulmonary embolism, which is very common with a stroke. They treated the pulmonary embolism and sent her back to Consulate for rehabilitation. She underwent physical therapy and occupational therapy to help her improve with her weakness. She wasn't progressing very well, so now she's kind of at a standstill, and they're hoping that eventually she will be able to improve to the point where she can be discharged back home to take care of her husband. Her past medical history was hypertension, 40-year smoking history, COPD, and an intracranial hemorrhage with right-sided hemiplegia, which is paralysis.
Okay, so let's now talk about what a stroke is a little bit and the different kinds. So stroke is basically a brain attack, right? Either your brain isn't getting oxygen because of a clot blocking, the flow of blood to your brain, or with the hemorrhagic one, wherever that, right there, there's like pretty much a, I don't know, it's kind of like an aneurysm, I guess, like your veins in your brain.
It's weakness and it bursts.
Yeah, it bursts, pretty much like what I thought an aneurysm was. So, and the treatment, it's going to be easier to treat an ischemic stroke where you just have a lack of oxygen, because normally that's going to be caused by blockage of your arteries. Like if, I don't know, you're, people with hypertension do have a problem with blocking their arteries. Let's be a little more organized here. Okay, we've got the two kinds of stroke. Ischemic, blood clot. Blood clot is a major thing. We've got smoking, which is going to exacerbate blood clots, right? Smoking, older age, diabetic, and of course COPD. Let's see. Treatment. Okay, some treatment for the ischemic stroke. We're going to try to thin the blood, right? We're going to put them on some anticoagulants, which we see a lot in older patients, especially if they've had a stroke, to keep the blood thinner so you're not going to get another clot and have another stroke. And also maybe some anti-hypertension medicine. And probably some pain medication because of some maybe residual pain that they're going to be experiencing. Some signs and symptoms of a stroke. We have a little thing right here that you look for if you're suspecting maybe someone's having a stroke. We're going to look at their face. They're going to have maybe an uneven facial expression. They're going to have a droop on one side. They're going to have difficulty talking, swallowing, and then we're going to see that they're weakness, like they're maybe they were doing something and then suddenly one of their arms just falls down. That's a pretty big one. Blurred vision is another big thing, and an unexplained headache is also a pretty good indicator of a unexplained, pretty severe headache. And something very important to do if you suspect somebody's having a stroke, you call 911 immediately, because the faster you can get them to the hospital, the faster they can get that oxygen back to the brain, the faster they can take care of the problem. Some nursing diagnoses that are going to be related to stroke are obviously going to be the cell care deficit, because they're going to have weakness. They're not going to be able to move to take care of themselves. They're going to have a risk for falls because they're going to be weak. They can't walk. Let's see, activity intolerance because you're weak because of the stroke. And also impaired skin integrity. You're going to be laying in bed because you're going to be partially paralyzed and you're not going to be able to move. Also, someone that Tabors gave us were ineffective tissue perfusion, lack of blood to the brain. The rest of you, impaired physical mobility, which we covered, impaired verbal communication, because, they can't talk. Pretty big one. Low self-esteem, which I thought was pretty big, because, you were taking care of yourself before, perfectly fine at your house, caretaker of your family, your mother, and suddenly you have a stroke. People are having to take care of you. That's seriously going to affect your self-esteem, which affects a lot of things. Which we have the Gordon's functional health here. It's going to affect your brain because your thinking process can be altered because of the lack of oxygen to your brain, which kills some brain cells. would imagine. Let's see. Yeah, and we already covered activity intolerance, so covered most of the stuff on here. So let's show you how to take care of somebody who has had a stroke. You know, maybe some nursing process type stuff. So Felicia is going to be our stroke patient. Maybe the typical day in long-term care, trying to get them rehabilitated and back home. Yeah, we'll go ahead and hopefully that's not yours. Okay. So Felicia's a typical stroke patient. She's also got emphysema from her smoking. So she's got her oxygen here. She's sleeping without it for now because we just came in and she's getting ready for, getting up, whatever. So we're gonna come in, we're gonna wake her up, and how is she doing? We're gonna check on her pain, check on her breathing, see, how she's feeling this morning, whether she's particularly weak, we're gonna have to give her back, and she's not gonna be able to do a lot of it on her own. She's gonna be pretty weak. You need to tell us, how you were taking care of your patient since she was.
Well, they are going to have difficulty doing everything themselves, so you assist them with their regular daily activities. You want to encourage them to do the most that they can for themselves. That way they can help improve their muscle strength and weakness. You're there to assist them. And the more that they do for themselves, the better off they're going to be, the better they're going to feel about themselves, which is a real big important thing with anybody, not only in long-term care, but in an acute care setting as well. So what I usually did was I assessed the patient, how she slept, asked her if she needed anything. We'd get her up to the wheelchair, and it's really important with right-sided weakness or any weakness at all that you're prepared to help them with whatever they need appropriately. Otherwise, there's a risk for injury to yourself and to the patient. So the best thing to do with transferring to a wheelchair is to use a gait belt. Also,